One.
Hello, good evening to everyone. Today we are going to talk about what's better we can do for IVF failure patients. Friends, today we have just witnessed Yoga Day, and we are seeing the largest days today, and the nights are small. So, uh, life is the same thing. It's it's hardship sometimes and it's peace at times, but you have to go through the hardships to finally find the peace, finally find the answer to your solutions, to your questions. So friends, it's very important to understand what's the solution to the most difficult problem. So in fertility, once we are dealing with fertility, we have multiple options in treatment, and one of the most important or advanced treatments is IVF. But suppose this IVF fails, what next? That's the question. So please don't get disheartened. We need to understand that we can have solutions even for problems of IVF failure. Only thing is that we need to understand what is the way we need to go ahead. What's the proper methodology of going in a IVF failure patient. So if we study IVF failure, there are three reasons for IVF getting failed. One, it's called as a soil, seed, and environmental theory. So the seed is important, the most important thing. That means the embryo. The embryo is the most important thing. If the embryo is not of a good quality, the IVF can be a failure. Secondly, the soil, that is the endometrium. So sometimes the endometrium can be of a weaker quality, the receptivity can be at a problem, and therefore there can be problems with the endometrium. Third thing is the environment. So the environment, that is the atmosphere around the embryo, that is with the uterine environment and the bodily environment. All these are important things to have a good success in IVF. So we'll see how do we evaluate each one of these. So basically, the embryo, a good quality embryo has to form to give a good success rate of IVF. And for a good quality embryo, we need a good egg and a good sperm. So optimization of egg quality and sperm quality is must before we go for IVF cycle. Any patient coming to me, I usually don't go and start the IVF cycle immediately. Some optimization has to be done so that before going for IVF cycle, there is slight improvement in the egg quality or sperm quality. If there are certain issues, we handle them prior. So if the egg quality basically can't be assessed as such by any tests, but the sperm quality can be checked by looking at the sperm motility morphology and also the sperm DNA fragmentation index. If there are certain issues with this, then we do give a antioxidant therapy, pre-medications for the husband for around 3 months, and post 3 months we check if there is improvement within these parameters, and then only we go ahead and do IVF. For improving the quality, basically we don't have any tests to detect abnormalities with the egg, but we can anticipate that the egg quality was poor if the embryo quality was poor. And after doing one IVF cycle, definitely we know about the egg quality. So how is the oocyte cytoplasm, how is the perivitellin space, is there any presence of debris, is there any presence of any bodies inside the cytoplasm. All these are problems which can cause a poor egg quality and can give less results. So improvement in egg quality is again needed. So two extremes of therapy, like low reserve and PCOS, can have problems with the egg quality, and therefore optimization in such patients is very important. So a 3 months antioxidant therapy, with along with that, correction of metabolic disorders in PCOS, along with that use of testosterone gel or dehydroepiandrosterone in poor ovarian reserve patients, all this is going to help to optimize the oocyte quality. Then we come to the IVF cycle per se. So there are different protocols which we can follow in IVF cycle. One protocol will not fit all. So one shoe will not fit all. Similarly, for IVF cycle, we need to understand that the success will be only when you have an individualized patient protocol. So the stimulation cycle, the stimulation injections have to be tailor made for that individual to give a better success rate. And therefore we at Oasis follow a individualized patient based protocol for a better success in IVF and to get better embryo quality. Along with this, we have certain other advanced options such as PRP and so on, which can give a better success rate in IVF. Second thing is the endometrium. So if the endometrium is thin, probably your success rates of IVF will drop down. So you have options like hysteroscopic PRP, estrogen treatments, vasodilator treatments, subendometrial PRP, and so on to improve the endometrial thickness. Along with this, we have problems with the endometrial receptivity, which can be assessed by endometrial receptivity array or the ERA test. There is something called as endometrial selectivity. There is something called as normal microbiomata of the endometrium. That is the normal organisms which should be there in the endometrium, which will improve the implantation rate. All this can be tested by doing certain tests, and we can use certain medicines to cure any infections within the uterine cavity, such as chronic endometritis, along with pre and probiotics to improve the implantation rate. The third thing is the environment. So, if there is any problem with the uterus, such as fibroids, adenomyosis, adhesions within the cavity, hydrosulfings, then endometriosis, all these problems can hamper the implantation rate, and therefore, diagnosing this problem at the first hand is very important. And if you are not able to diagnose by just doing a basic sonography, you have options such as hysteroscopy, laparoscopy with you, which can help you to diagnose and treat in the same sitting. So diagnosing and treating these problems which can impair implantation can also be used. There are certain immunologic causes of IVF failures which can be assessed and which can be dealt with accordingly. There are certain causes where you can do a lymphocyte immunotherapy, intravenous immunoglobulins, intravenous intralipids. All this is going to help in a selected category of patients. So therefore, choosing the right patient or choosing the right treatment for that patient is very important. One treatment again cannot fit all, so please don't read the internet and uh, you know uh, come to any conclusion. We need to understand that whatever is present on the internet, usually as a fertility specialist, we already know those treatments, but we channelize that treatment for that particular patient. So every treatment may not be available for every patient, or should not be used for every patient. A individualized treatment should be followed for each and every patient to get better success of IVF, better success rates in IVF. So friends, IVF can sometimes be distressing if it gives negative result, but please don't be distressed. There are certain solutions available to it, and if we go in a methodical fashion, even the first IVF cycle can be positive. But if your first IVF cycle has failed, please mark my words that you can have certain other options of treatment. Thank you. So, if you have any questions related to IVF failure, please do contact us, and you can visit us for a free consultation at any of our centers in Pune. We have our two centers at Oasis Fertility, Kaspate Vasti Vakad, and Oasis Fertility, Harisa Avenue, New Fountain Road, Kharadi. So, please be sure of taking an appointment with me, and we can have answers to your question. There is certain question which is coming in front of me: how long we wait before trying for another IVF cycle? Yeah, so basically this investigation and supplementary therapy is very important before we go in for the next cycle. So please don't be in a haste for your treatments. Please follow the methodology shown by your doctor. So as fertility specialists, we always give time for diagnosis. We always give time for pre-treatment, and then only we give for go for next IVF cycle. This time can be anywhere between 2 to 3 months to up to 6 months, because sometimes a larger amount of time is needed for improving or optimizing your success rate. Yeah. So, what are the next steps after a failed IVF cycle? Yeah, we discussed that we need to diagnose what is the problem with the embryo. Is there any problem with the endometrium, or is there any problem with the uterine environment or the environment in the body? Is there any immunological problem? Is there any problem with the blood clotting disorders? And similarly, we go and try to find the cause. So go and try to search for the diagnosis if there is any genetic problem. And once you have made a diagnosis, please be sure that you get answer to that, by taking proper treatment. Next question is coming here to me. I'm trying for 4 months for IVF, and first IVF failed because endometrium was not growing properly. That's the question. So, uh, as we said, that endometrial preparation is quite important. It is responsible for around 40% cases of IVF failures. And if your endometrium is less than 7 millimeter, the chances of failure are quite high. So we try to optimize and bring the endometrium as high as possible. There cannot be ideal endometrium for each and every patient. Sometimes there can be endometrium which is adequate for that particular patient. So this patient is saying that she has a hypoplastic uterus, and she has already done hysteroscopic PRP for that. So we need to understand that it's the hypoplastic uterus which is a problem. So we need to build the uterus also in the size by giving a 6 months of hormone replacement therapy, trying for a longer period. Using alternative regimens also can help. So this is going to help the patient. The next question coming to me is that IVF or IVM, which one has more possibility of success? Right now, we are using IVM, especially for PCOS patient, where we don't want hyperstimulation and where you don't want any higher dose of medicines to be given. But for poor responders and normal responders, we are still following IVF. And therefore, for PCOS patient, IVM can be a choice. But for other category of patients, IVF and IVM both, IVF is a better choice. And for PCOS patient, even along with IVM, we can also do IVF. The next question coming to me is T-shaped uterus a problem? T-shaped uterus per se doesn't cause any problems, but if the T-shaped uterus is causing thin endometrium, and if it has already caused an IVF failure, probably we need to correct the uterine shape by doing a lateral metroplasty, by doing a simple procedure called as hysteroscopy. So you just put in a small hysteroscope, which is office hysteroscope, and you don't require any anesthesia for that. And sometimes you may get only small anesthesia, and you do that hysteroscopic metroplasty procedure, and the cavity correction, T shape becomes a triangular shape, and the success rate increases, and the thin endometrium can also be treated. Yeah. So the question again, uh, next patient is asking, what we talked regarding was for a hypoplastic uterus and thin endometrium, success is possible in many of the cases. However, endometrial volume has to be studied, and multiple cycles of estrogen progesterone treatment may have to be undertaken, and hysteroscopic PRP also may have to be tried again. And we need to see the case file, we need to see the uterine size and everything, so that we can come to conclusion. So you can come to any of our nearest centers, the center near to you, and we can have give you a free consultation and tell you regarding the success rate, depending upon what ultrasonography findings show. So we need to do the ultrasonography by ourselves also, by doing looking at the endometrial volume. Thank you so much for the wonderful questions. This is our Oasis helpline, which you can contact and get in touch with us for a consultation. It was my pleasure to interact with you. I'm Dr. Nilesh Balkawade, Clinical Head, Oasis Fertility, and Regional Medical Head at Oasis Fertility. Thank you so much.